start again. I'll start again. You good?
Yep, thank you.
Thanks for joining us here today. I'm here with the Health Minister, Amber Jode Sanderson, at this warehouse stocked with some of the state government's rapid antigen test stock. Before we get to the rapid antigen tests, I'll start with COVID update. To 8 p.m. last night, Western Australia recorded 68 new cases. 38 are new local cases. Of these, 27 are linked to close contacts of known cases, 25 are travel-related cases, and a further 5 cases are being followed up by contact tracers. Some of the new local cases were infectious in the community. All new cases are in quarantine. 10 of today's cases are from positive rat tests. Yesterday, 4,395 people received a PCR test at private and public clinics. As our case numbers continue to rise, I remind people to take Omicron seriously. If you're unwell, stay home from work or school and get tested immediately. Our PCR testing clinics have capacity. I encourage everyone with symptoms to go get a PCR test while capacity remains at our clinics. While the PCS test number may seem relatively low, it's important to remember PCR tests are not the only diagnostic tool that can be used in Western Australia at this point in time. People are also using rat tests. On Tuesday, we entered a high caseload environment. In a high caseload environment, rapid antigen tests, or RATs, are able to be used as a diagnostic tool. Rapid antigen tests are a quick test to check for COVID-19 and provide a result within 15 to 30 minutes. And all kits have a QR code which links to a video that demonstrates how to take the test. While rapid antigen tests can now be used, PCR tests are preferred while we still have capacity in our PCR testing clinics. Currently, our PCR testing facilities have a capacity for 35,000 tests per day. Currently, the state government has 8.8 million rat tests in stock, and that number is growing each and every day. This coming week, our stocks are expected to hit 11.2 million rapid antigen tests. Based on our current orders, we anticipate to have more than 100 million rats by the end of April. We're currently distributing rats to all public COVID testing clinics. This is being done to manage demand and wait times, as well as to support the testing regime for interstate and international arrivals. All domestic and international arrivals into Perth Airport are provided with 2 rapid antigen tests as part of mandatory Day 1 and 7 testing. Rats are also being used to screen patients at WA public hospital emergency departments. The introduction of rats at public hospitals means greater protection for patients, staff and the community, as workers can more easily identify those patients that need COVID-19 precautions before entering the emergency department. We are now also seeing rat supplies available at shopping centres and pharmacies. This is great to see. It's important for concession card holders to know that under the agreement at National Cabinet, they are eligible for up to 10 free rat tests from pharmacies over a 3-month period. To get these free rats, you must hold one of these cards: Commonwealth Seniors Health Card, Healthcare Card, Low-Income Healthcare Card, Pensioner Concession Card, Department of Veterans Affairs Gold, White or Orange Card. It's important for people to remember that at all times, positive rapid antigen tests results must be logged with WA Health. Reporting a positive result is mandatory. Anyone that has tested positive using a rat test for COVID-19 at home or in the workplace should register the result at www.healthywa.gov.au/rat-register. We need to have line of sight of the virus in the community. We're relying on everyone to do the right thing for your sake and the sake of everyone else. I'll now hand over to the Health Minister.
Thank you, Premier. Today we're also announcing the launch of a new advertising campaign. The Managing COVID-19 campaign helps to prepare and empower West Australians with information on how to manage living with the virus. This is particularly important given we are experiencing high caseloads and have recently implemented new testing and isolation protocols to respond to this. It's essential that people understand what they need to do and when. The campaign communicates the definition of a close contact, testing and isolation, and how businesses can prepare to manage COVID if a staff member returns a positive result. It will run across television, radio, print and digital. This includes metropolitan and regional areas, and on culturally and linguistically diverse and Aboriginal and Torres Strait Islander channels. A Managing COVID-19 visual booklet is in production to support the campaign and will be translated into several languages. The booklet covers subjects such as how to create a COVID kit, how to stay safe at home, symptom detection, isolation and testing protocols, close contact definition and PCR and RAT testing information. As you can see here today, our rapid antigen tests are plenty and increasing every day as our orders continue to come in. These RATs have an important role to play, and particularly while we're in a high caseload setting, and already being used in our hospital emergency departments and being given to travellers at airports. It is essential that close contacts of cases and those who are symptomatic get tested. PCR testing remains the recommended testing, and our clinics stand ready to assist. There is plenty of capacity. But of course, you can also take a RAT, and if you receive a positive RAT, you must register this at healthywa.gov.au. Getting tested and getting vaccinated, including your third dose, are the best things that you can do for vulnerable people in our community. Omicron is here now, and our public health and social measures, including mask wearing and isolation, are doing a good job of keeping case numbers low, but we do not expect that this will continue forever. We know the Omicron variant is highly transmissible, and the Chief Health Officer expects case numbers will increase. And that means the following health directions remain as important as ever. Get tested if you are unwell or are a close contact. Get vaccinated. Check the exposure sites regularly. Continue to use the Service WA and Safe WA app. Wear a mask and keep your distance from others, and continue to wash your hands. Thank you. I'll now hand back to the Premier for questions.
Thank you, Minister. Any questions?
Premier, are you aware of another outbreak in an aged people's home?
I'm aware that there is additional cases at the aged care home that's already been announced, the Juniper Aged Care Home. I understand it's up to 17 cases in total now.
Are you aware of a second care home? I think it's a Brightwater care home has now got an outbreak as well.
No, I'm not. I'm sorry. No, I haven't been advised of that. I'm sorry. It may well be included in today's numbers, or maybe that information is coming through as we speak.
There was only 1,500 tests yesterday, and what is it, 3,000, just over 3,000 today, in the last 24 hours. It's still really, I mean, the numbers are going up, but does it still mean that there is a much more penetration of the disease in the community because there's not enough testing being done to realise the full extent?
So there was 4,395 people got a PCR test yesterday at public and private clinics. There would have been a large number of rapid antigen tests as well, but we don't know how many are conducted because people do them themselves. 10 of the positive cases that we're reporting today came from people uploading their rapid antigen test results. The chances are that there are cases out there we don't know about, probably in large numbers. But we are encouraging people to get tested. We're asking people if they're unwell, if they're symptomatic, please go and get tested. The capacity is there at the PCR clinics. Basically, they're doing about 15%, 20% of their full capacity. So please go and get tested. You can also use a RAT test. We just need to know what the spread of the virus is in the community, and we rely upon people doing the right thing in order to inform us of that.
Just on the growing outbreak at Juniper Signet, of the 17, do you know how many are residents, how many are staff?
I don't, I'm sorry. All I know is there's 17.
Reports today that when you do set a new date for bringing down the border, that will happen within days or a week. Is that the plan?
I don't know where those reports arose from. There hasn't been any decision on that. What we will do is review this matter over the course of February, and we're currently looking at it, as you know. The review is based upon the growth in vaccinations, which is going up very, very quickly. We're basically at 50% third dose now. And also what's happening in the east. it appears the infection rate is going down. So the original date, the February 5 date, would have meant we opened the border with no rules, no protection when the eastern states were peaking. So as their numbers go down, that is obviously a good sign, and a good sign for what we can do in the future. In terms of the vaccine rate, that's actually the main issue. So we've just got to keep getting people vaccinated. I know that, and I saw some protests yesterday in Canberra, I think it was. You know, a lot of people are unhappy about the vaccine mandates. All we're trying to do is save people's lives. That's all we're trying to do. Save older people, immunocompromised people, the broader community. Just save people's lives. And I know it seems to have caused some angst, but I think in the overall scheme of things, when you look at Australia versus other countries around the world, the United States is basically at 1 million deaths now, and Britain's at 150 to 200,000 or so. When you look at Australia, our performance has been hugely better. And in Western Australia, obviously, we've now had 2 people acquire the virus here and pass away. So getting people vaccinated works, and that's why we've done it. That's why we've made the decisions that we've made, because we know it works. I read an article in the Sunday Times today about how the advice from the Commonwealth Government is that the 3rd dose increases your immunity to 88%. And so the 3rd dose is crucial to saving lives. And that's the advice from the federal regulatory bodies. That's all of the medical advice. That's why we've made the decisions that we have.
Just on that, the importance of the booster, the CDC in America over the weekend have also released their latest data, and it shows that protection from the booster against being hospitalised from Omicron dropped significantly after 4 months. Now it's been 13 weeks since the booster started to be rolled out. So is that going to be in your thinking to ensure those people who receive the booster are still protected?
All those things are part of our thinking. I raised this matter at National Cabinet on Friday. Dr Paul Kelly advised us directly on 2 occasions. He said that the 3rd dose is crucial and to preventing severe illness, and it lasts for a lot longer in terms of effectiveness than, he said it lasts for quite a while in terms of effectiveness. What he also said was that if the waning effect is more around transmission rather than the protection against severe illness. So over time, the waning effect is about you're more likely to transmit, but your protection lasts for a lot longer. So that's the advice the Commonwealth Government gave to us on Friday. And as I said, I just read in the Sunday Times today that there's an 88% increase in effectiveness against hospitalisation by having a booster, and it's a protection against serious disease and transmission, according to that article based upon ATAGI advice. But in any event, we all know getting a 3rd dose will save lives, and making sure people have had the opportunity to get a 3rd dose will save lots of lives. And that's why we've done what we're doing.
When will we see tougher restrictions if the case number keeps going up?
Well, they're called public health social measures. We currently have 2 in place. One is mask wearing in indoor environments in Perth, Peel, South West, Wheatbelt and Great Southern, and the other is the vaccination requirements to go into certain premises. So they're currently in place. Further public health social measures we'll consider as case numbers grow. We haven't actually made a decision on when they'll come in, but at some point in time they will come in.
Tourism Australia has launched a new international lure advert for visitors to lure visitors. It's strangely called "Don't Go Small, Go Australia." But we're obviously not included in that because our borders aren't open. Got a comment on them going rogue on us?
Well, eventually we'll open to international tourists, and clearly we'll have the financial capacity above and beyond the other states to attract international tourists because we kept COVID out. We've got the best financial performance of any state or government in Australia, so we'll have the capacity to put in bigger, better tourism campaigns and bigger, better campaigns to attract international students. But look, I understand that they're going to launch this. We'll no doubt join it at some point in the future.
It's a bit of a strange title.
I couldn't possibly comment.
Just back on the restrictions, It would be debilitating for WA businesses to have both gathering limits, density caps and a closed border at the same time. Is there going to be financial support for them?
Look, the best financial support we've provided to businesses is keeping COVID out and keeping the infection rate low. And that's been our plan that has assisted. We announced a package the other day for a range of businesses impacted by the delay to the border, particularly international education, travel agents, some tourism operators, and those sorts of arrangements I think are important. Look, when the public health social measures, the main ones are actually already in place: mask wearing and vaccination requirements to go into certain venues. The others will not be, certainly the first round would not be particularly severe, and they're an independent thing of border arrangements. But I just remind you all as well, I think it was the other day we had figures, I think 20,000 people have come in from the east in the course of the last week. People prepared to do a week's quarantine and get tested and catch up with family. So lots of people are already taking advantage of the opportunity to come to WA safely.
Premier, the AMA yesterday called for WA to adopt South Australia-style restrictions, so go early, and those restrictions include things like 50% capacity limits on businesses. Can you give any indication to businesses if that is likely to happen in the next few days?
Look, we constantly monitor. It depends upon caseloads, and we'll monitor and watch what's happening in the community. We can't give any exact assurance on these things at this point in time. You finished with me?
Just one question for you. It's just on the shark rules that were announced today. Are you hoping
The what, sorry, ma'am?
shark rules, the anti-shark fishing rules off?
Yeah, okay, yeah.
Are you just hoping that gives swimmers more confidence, and why haven't we seen something like this implemented sooner?
Just remind me, this is by the council?
Yeah.
Well, this is a matter for the council, but I think there's some concern that having that sort of fishing off swimming beaches attracts sharks. So understand why the council's done it, and that's their decision, and we don't object. Thank you.
Sorry, just one quick question on rats. WA's been accused of being late to the party in ordering rats into the state.
Right.
Obviously,
Okay.
you've got evidence to the
Okay.
contrary.
Yeah.
You've previously been asked when the exact date that the state placed its first order for rats, and you've been unable to provide it.
Yeah, it was mid-December. It was mid-December. But the thing about it is that we have not had major community spread of the virus, and so therefore we have more than enough rats. Other states had massive spread of the virus, and they didn't have enough rats. So our situation, once again, by being cautious and careful, has meant that we are better prepared than other states to deal with what confronts us. But as you can see now, we're at 8.8 million rats, growing to 11 million within the next couple of days, growing to 100 million. So we will have more than enough supply to meet the needs of the community. Thanks very much.
Can I ask just on that?
On rats?
I've got a couple of questions.
Okay, on rats, I do want to acknowledge the incredible work of Pathwest and the Health Support Service in their procurement, in their repackaging and in their distribution efforts. It has been an extraordinary effort and across government, so I want to thank everyone involved for getting us so prepared.
Is 100 million kits going to be enough?
I think 100 million kits will be more than enough. That's certainly our expectation, but we'll continue to purchase and procure as much as we need to. We will have in the next, well, we've got at least 8.8 million, but several 100,000 come through every day. So certainly within the next day there will be up to 10 million on hand, and that includes the professional kits for the healthcare sector and also for those self-kits that we saw in the box for individuals to use at home.
Can you, just on masks, can you clarify what the mask rules are in hospitals? Do they include patients mandatorily having to wear masks all the time?
I don't think it includes patients. I'm happy to get clarification for that, but the mask rules are for visitors, and visitors because it's an indoor setting. But I'm happy to get clarification around for patients exactly, but I wouldn't have thought so because it's essentially they're living there for that short period of time.
And are unvaccinated women treated any differently to vaccinated women in labour wards and all those sorts of things?
Our healthcare workers treat people as they come through the door. That is what they are trained to do, whether they are vaccinated or unvaccinated. So everyone is treated the same in our system.
Minister, in relation to the use of rats in hospitals, can you outline for us how they're being used right now?
At the moment, rats are being used to screen people coming into emergency departments, because that is that's the wide open door that everyone can and should walk into when they need health care. Essentially, if you are not facing a life-threatening, a level 1 or 2, then you will be sat in a triage area. You will be screened in those triage marquees and given a rat test, and you have to wait your 15 minutes until that rat test comes back, hopefully negative. But if it's positive, you'll still get treatment. You are just treated with the COVID precautions and put through that stream. If you come through in an ambulance and you have life-threatening injuries, you are tested during that treatment. So you are brought right into EDs immediately, and that test will be performed as you're receiving treatment.
So the ABC has seen internal documentation that indicates rat tests are being rationed at hospitals in ER rooms, and they're only being used to test symptomatic patients. Are you aware of that situation?
That's not the policy. The policy is to test everyone who comes through emergency departments. And there's no requirement to ration rats. As you can see, we have millions of rats. And we've done that. We've used the time wisely to make sure that we've purchased plenty of rats, particularly for that healthcare setting.
So is your policy going forward that all patients will be tested with rats at hospitals in WA?
Going forward, patients who come in for elective surgery will be tested with rats. Correct.
How much of the 100 million rats cost taxpayers?
It's around just under $500 million.
And is that cost shared with the federal government?
Yes, it will be. We expect 50% of that back from the Commonwealth. And the Commonwealth are providing, of the 100 million rats West Australian government has purchased, the Commonwealth are providing 1 million.
Okay. And at the aged care settings, obviously a Commonwealth responsibility, but will any state purchase rats be going into those homes that have outbreaks?
Absolutely. So if I know the Commonwealth has had issues getting their PPE and rats across the border, I think, and those aged care homes have not had access to the Commonwealth supply. I've met with all of the major providers. They're meeting weekly and probably more frequently now with the department, and my message to them and to the department is if you require access to the state supply, we will give you access and we'll work it out with the Commonwealth afterwards. We will not be quibbling on the ground about PPE and rats when it comes to vulnerable residents.
Legionella disease, is there a problem with Legionella at Sir Charles Gairdner Hospital?
Well, Charlie's is an aged building with a very challenging plumbing network. I know that the hospital takes it very seriously. Their screening of water, their regular testing and remediation where they need to, and they continue to do that. They've certainly taken a number of extra steps over the last few months to make sure that that water is regularly screened, and increasing chlorine levels, for example, to make sure that water is safe for patients.
It's not acceptable, though, is it, that a vulnerable patient can go in and then catch another disease in a hospital setting and even die from it? That just shouldn't be happening.
Well, look, it is a challenging setting, Charlie's, and every effort is made to make sure that the hospital and the rooms are safe for patients. I think there is one case that has potentially been confirmed that they caught it at the hospital. The others couldn't be confirmed, and it is in the community. So we want patient safety is the absolute priority of all hospitals, and it's my priority as Minister. I'm very confident that not just Charlie's but other hospitals are now working with the Environmental Health Directorate to make sure that we have really stringent and strong policies and screening processes in place, and that they are consistent across the hospital system.
Roger Cook stood up in Parliament, I think it was October last year, when he was asked about a Legionella case, and denied it, and I think there were shouts from the government benches about fear-mongering, because you guys clearly didn't have the facts. Have you sought assurances from the DG that you'll be properly briefed and that this type of information will be made public?
I've spoken at length with the Director-General and the hospital service provider about this issue. It was an administrative issue, an administrative error that they didn't brief up to the Minister. It's not acceptable. They have apologised for that, and they understand that that information needs to be readily available. Okay?
Thanks.
All right, thanks.